Dizziness is a very general term, and in fact, many things in medicine can cause dizziness. But in the ear, the most likely cause of the dizziness is really from the vestibular organ. The fact that Miss Kwok actually doesn't have any ringing in the ears or any hearing problems, the reason for that is that the inner ear, the cochlea, is not involved. If you look at this model here, this is probably the cause, which is the vestibular organ. There are two vestibular organs in every patient, and when one of them is a little out of sync, what then happens is that the brain gets very different signals, and it interprets as if there is some movement of the head when there is none. And that actually is what causes the sensation of dizziness as experienced by the brain. For an ear cause of dizziness, the most important thing is actually the history, the story that the patient tells you. A specialist who will listen carefully will often have the answer to the cause within the space of actually taking the history from the patient. Thereafter, what is done is really to confirm that the patient really does have dizziness due to the ear problem. And usually in this case, it requires an inspection of the ear canal, and the eardrum, a quick clinical test of the hearing, just with simple tuning fork testing, and finally, particularly as it's dizziness, we often do a provocation test, whereby we stimulate the patient, in fact, to make them dizzy. The treatment for any condition, example dizziness, is really about cause and symptoms. If you know the cause, you treat the cause directly. But usually, dizziness is a symptom that the patient experiences, and therefore the treatment is usually symptomatic. Firstly, drugs can be used, example, the anti-labyrinthine sedatives, and they work by crossing your blood-brain barrier, numbing this organ, and therefore reducing the total activity from it, and hence you feel better. But drugs, when they wear off, will also mean that your dizziness can recur. In incidences where the cause is due to what we call calculi, or little stones that are trapped within these bony tubes, the best treatment by far is really to do therapeutic maneuvers, which slowly encourage these little stones to move out from these tubes into this large cavity here, which we call the saccule. Then the treatment is not just improved, it is cured.
Fine Doc, your doctor is here.